Journalistic investigation. Third-generation teeth. Japanese scientists have learned how to grow new teeth in humans. June 2025, Tokyo, Japan. Author. Special Correspondent for Grenier Realnosti. Introduction. Scientific sensation? Or the beginning of a new era in dentistry? In a world where millions of people suffer from tooth decay, tooth loss, and expensive prosthetics, a scientific breakthrough has occurred in Japan that could revolutionize dentistry. A group of Japanese researchers from Kyushu University, in collaboration with the pharmaceutical corporation ToriBio, has announced the successful development of a method for growing new teeth in adults. The official publication in Nature Biomedical Engineering caused a sensation in the scientific community, and behind the scenes a real battle began between pharmaceutical companies for the right to commercialize the technology. We conducted our own investigation to find out how this technique works, who developed it, and what Japanese scientists are hiding. How does it work, the technology for growing third teeth? According to an internal report from Professor Takashi Nakamura's laboratory, the basis of the technology is the activation of latent tooth buds, which in most people remain inactive after the formation of milk teeth and permanent teeth. Scientists have discovered that up to 3 generations of teeth can be laid down in humans during the embryonic stage, but the third generation is normally suppressed by a special protein called USAGU1. The key to success is a monoclonal antibody that temporarily blocks the activity of USAG1. After its introduction, the body remembers the hidden germ and starts the process of forming a new tooth with its own roots and perfect anatomy. The first successful experiments on dogs and macaques were conducted back in 2021, but in 2024, secret clinical trials on humans began. Secret trials? Who were the test subjects? According to our data, the trials were not publicly registered in international clinical research databases. Journalists from Grenier Realnosti found out that the first phase of human testing took place at a private dental clinic in Osaka Prefecture. Several patients who had lost 1 or 2 teeth were injected with an experimental drug codenamed ToothRegs X. After 3-4 months, the patients began to grow full teeth in place of the lost ones. Our source at the clinic, who wished to remain anonymous, claims it looked like a miracle. One man who lost a canine tooth in an accident grew a completely new one in 120 days. It wasn't an implant or ceramic, it was a living, real tooth. However, it was not all that straightforward. Dangerous side effects and silence from the authorities. Some patients reported side effects, inflammation, gum hyperplasia, and pain when new teeth erupted. One participant experienced abnormal growth of 2 teeth in one place, which required surgical intervention. There is no official confirmation of the incidents, but the silence of Japanese regulators and the Ministry of Health's refusal to comment on the situation is cause for concern. We tried to get comments from representatives of Kyushu University, but received a short reply. The technology is in its early stages. Clinical trials are ongoing. We do not comment until all stages are complete. The battle for the patent, who will become the monopolist? On the International Patent Portal, we found that at the end of 2024, a patent entitled Method for Inducing Human Dental Regeneration via USAG1 Inhibition was filed in the name of ToriBio. At the same time, the American company Regenera Teeth Inc. filed a counterclaim claiming that the idea was taken from their 2017 concept research. This could lead to a protracted legal battle that would delay the commercial implementation of the technology for years. What does this mean for humanity? If the technology proves to be safe and effective, it could revolutionize medicine, completely replacing implants, bridges, and dentures. People will be able to grow new teeth naturally without surgical intervention. But the main question remains open. Is the world really ready for such a radical change, and whose interests, those of patients or corporations, will take precedence? Conclusions. Japanese scientists have actually achieved tooth regeneration in adults by suppressing the USAG1 protein. The first phase of clinical trials was conducted in secret, and there is evidence of side effects. A patent war is underway between Japanese and American corporations. The widespread adoption of this technology could change dentistry forever, but for now, it remains in the hands of biopharmaceutical giants. Stay tuned for updates. Granny Realnosti will continue to follow developments in this story. If you have information about similar research in other countries, please write to us anonymously.